All right. So this is going to kind of feed into what you just talked about. But when I was a undergraduate at Johnson C. Smith, many of us pondered going to medical school, and we all said we wanted to do it, but few of us understood what it took to get in there. And one of our faculty members actually told us that. And you talked about this at the gathering that we met at, and I was very impressed with what you said. What things are you guys looking for now for students for students that for prospects? I remember you said you want them to have touched patients before.
That's true. It's a genuine. We want to see that you've had a journey of learning. Number one, about the didactics, the science component, yes, but also about humanity, about doing volunteer service for people who are less fortunate than you are, so that you understand the social determinants and the behavior, sometimes even the behavioral determinants of health and how they manifest themselves in our community. We want you to have spent some time doing some type of hands-on patient care, either from learning how to take a blood pressure and learning how to take vital signs in a doctor's office, or being an EMT and helping to triage patients and get them to the emergency room, or just driving an ambulance that takes people to their regular hospital visits, to being a nurse, being a CNA and doing the hands-on dirty work in the hospital, to being a pharmacy tech and spending time working in a pharmacy with people coming and have questions about their medications, and you spend time helping them to understand about their medications and the side effects and reactions of other drugs and things of that nature, to being a hospice volunteer and helping people with end-of-life issues. These are types of things that we're looking for hands-on wise with our students. Yeah, a lot of smart people in the world. There's a difference between being smart and having intelligence. We're looking for more intelligent people than we are smart people.
Okay.
Smart people know how to answer a question. They get a question right all the time, but they don't know how to talk to people. They don't know how to deal with the human component. Intelligence is having the ability to know what you know and be able to apply it to the people that are in front of you at the right time, for the right person, for the right reason.
Okay. Now, on that same vein, one of the things we discussed was you're looking. I think you asked students, why do you want to go to medical school, and you said you're on the kind of on the lookout for cookie cutter answers, right? You want to hear some depth to their answer.
Yeah. Well, the depth of the answer comes in multiple different ways. For instance, when somebody writes about the experiences that they have, I don't care what they did. I want to know how did it make them feel. I want them to be able to explain to me if there was a significance that changed their perspective about how they view dying if they worked in a hospice, how they think the healthcare systems works with the donut hole as it goes to prescription drugs, how nurses are so overworked and have too many patients, such that a CNA becomes so very important, and how to take care of people in the hospital, and how people who don't have family members to come visit them in the hospital are left alone. And if it wasn't for the CNA, they might not have anybody that works with them. The why, the what. What did you observe? What did you learn? That's more important to me than what did you do.
Mm-hmm. Okay. And CNA stands for?
Certified Nurse Assistant.
Okay, Certified Nurse Assistant. Okay.